After you eat, do you often experience heartburn? Well, it could be gastroesophageal reflux disease, or GERD. This painful disease is a digestive disorder that affects the muscle connecting the esophagus with the stomach. It can have symptoms ranging from minor heartburn to bleeding and inability to swallow. The Lynn Health Science Institute has been studying this problem for 11 years, and it's found that sometimes a non-invasive surgery can help. Dr. Michael Reif is the newly appointed medical director of the Lynn Institute, and Dr. William Orr is the president and CEO. And we're so glad you're both here to talk about this thing. My husband and my son have it, so I really want to know more about it. First, Dr. Reif, what is acid reflux disease?
Acid reflux disease is the bringing up of stomach contents which is very acidic into the esophagus. Mm-hmm. And when it occurs on a regular basis, it can cause damage to the lining of the esophagus, which is very sensitive to the reflux. Mm-hmm. And that damage can be manifested simply with just pain, as in heartburn, or it can be manifested with problems associated with ulceration of the esophagus, which eventually can lead to stricturing or narrowing of the esophagus. It can lead to bleeding from the esophageal ulceration. And then there are a set of other complications of this that can affect breathing. For example, if acid reflux occurs to the point where it gets up to the level of the larynx, then voice problems can occur, polyps on the vocal cords, aspiration into the lungs, even dental problems can occur from this. So there are a whole host of things that can be related to GERD.
And Dr. Orr, how does the Lynn Health Science Institute fit into all of this?
Well, Jerry, our interest in GERD goes back many years and really began when I became interested in the issue of this acid reflux, which Dr. Reif just described, and when it occurs during sleep. We began a research program over 20 years ago, really investigating the ultimate consequences of GERD when it occurs during sleep. And what we've come up with and published many, many papers on over the years is the fact that that is perhaps the single most important element in developing the complications of this disorder. All of the complications Dr. Reif talked about probably occur exclusively in patients who reflux at night.
Okay, so besides the research arm, though, of the Institute, people can come to the Institute to be diagnosed.
Oh, yes, they can. They can come. We have both a medical director, two medical directors, Dr. Reif being the medical director that handles the surgical end of things. We also have another gastroenterologist who works very closely with us. Dr. Deborah Blaylock and Dr. Michael Grossman both work closely with us. So we can pretty well cover the waterfront from getting individuals into the appropriate kind of medical treatment, and if that fails, we can refer them to a very competent, excellent surgeon here, Dr. Reif.
Okay, and that's where we're going to pick up now. Speaking of treatment, what's been traditional and then this new surgical technique is relatively non-traditional. Huh?
Right. Jerry, the basic treatment first means over-the-counter medications, probably like antacids. You can now buy H2 antagonists or drugs like Pepcid or Zantac or Tagamet over the counter, and a lot of people will try these before they even see a doctor for the first time, and that's just fine. But if they continue to manifest symptoms, then they need to be further evaluated because there are more potent prescription medications that can be used to treat this, such as Prilosec, what we call proton pump inhibitors, and these are very potent inhibitors of acid production by the stomach.
Right. Lots of people use Prilosec.
Oh, that's right.
Days,
It's a tremendous drug, and there are some variants on that drug now being made which are even more potent that can be used to suppress acid production. But even with all that, then there are probably 10% of the population who have GERD on a regular basis that will require something more. They don't respond to medical therapy, or they've responded and then they lose that response to medical therapy. And so that's the group of people that I'm very interested in seeing be evaluated, because then the necessity for surgery is there. And surgery in the past has...
You're not talking about surgery with scalpels and things of that sort.
No, we're talking about now an endoscopic or laparoscopic procedure. In the past, we had to do an open operation with a big incision, and there were more complications, and quite frankly, I don't think we could see as well with an open procedure and a big incision as we can see now with scopes, high-resolution cameras, fiber optic light sources and things of that nature that really allow us a beautiful view of the anatomy to allow us to do a surgical correction of the problem.
Okay. Now, is this procedure for everybody, the surgery for everybody who has GERD?
No, definitely not. I think most people will respond to various types of treatments such as we've alluded to.
Right.
In addition, some will respond simply to lifestyle modifications. 20% of the population may do very well on just lifestyle modifications such as weight loss, change in diet, and things of that nature. But then when we get down to the 10% of people who have not responded or who have lost their response or who develop complications such as the respiratory problems, then we need to proceed with evaluation for surgery. And that's where the Lynn Institute comes in handy in helping us get these patients evaluated appropriately to know if they are good candidates for surgery.
Okay, we don't have a lot of time, but I know there are people out there saying, well, how do I find the Lynn Institute? I've had this problem for years. What do you tell them?
Well, Jerry, we tell them to call 405-44-STUDY. And if they're interested in one of the research studies that we have ongoing,
Clinical trials and
the
things
clinical
like that?
trials that we're doing in reflux disease, we can certainly consider them for that. And if they're interested in being evaluated as a possible candidate for surgery, we can certainly handle that and refer them to Dr. Reif. So that would be one place to call if any of your viewers are interested in this.
Okay, sounds very hopeful. I like it. Thank you both for being here.
Thank
you,
you.
Jerry.